It's almost as if when Margaret Wambui takes 2 steps forward, her disease takes her 4 steps back. After KTN last week highlighted her rheumatic heart condition and the effect it has had on her family, Margaret was immediately admitted to the Kenyatta National Hospital. The little weight she had gained in preparation for her surgery was lost. Rheumatic heart disease is a hard disease to live with and is the most dangerous of all heart conditions among children and adolescents. Ironically, it's the easiest disease to prevent.
Rheumatic heart disease actually has been prevalent in low socio-economic status, meaning where we have crowding, undernutrition, poverty.
It begins with an infection of the throat by a bacteria known as streptococcus. Like any bacteria, it harbors an unclean environment with an ability to adapt to any change. It can cause a myriad of diseases, but when it comes to rheumatic heart disease, the first telltale signs is a sudden sore throat, painful and inflamed tonsils that will make it hard to swallow.
Should you as a parent find your child, or you are called from school that your child suddenly is not well and was well in the morning, please take to hospital.
A strep throat is different from normal sore throats. When looking inside the mouth, one can see swollen tonsils on the inside, and there is a sort of rash or crust at the back of the mouth.
And the treatment is very easy. Just a shot of penicillin or treatment with oral penicillin at the very earliest, and it will save this child a lifetime of trouble.
However, more often than not, parents and health workers normally misdiagnose strep throats. And once the condition is misdiagnosed, it develops into rheumatic fever and unexplainable tiredness.
You develop pains on your joints. So you had a strep throat, then now you have pains on your joints, all the joints. You have inflammation on some of those joints. You could have some other features like chorea. Chorea is an abnormal movement of the body, large body muscles. You could have carditis. Carditis is affection of the heart, so that the heart is being incompetent.
We treat, but none of us has really concentrated and put the statistics together. However, we are still seeing quite a lot of rheumatic heart disease, quite a lot. And I'm only talking about the patients who come to Nairobi, because majority of us cardiologists are in Nairobi. They come from all over the country, but what about that poor one who can't afford to come to Nairobi?
At this point, the child must be taken to hospital for treatment, because if the fever is not arrested by this time, it gives the streptococci bacteria time to make its way to the heart valves, where the bacteria eats at the flesh and causes holes or causes the valves to collapse. It is at this point that the disease becomes permanent.
Where now this child starts to have his heart failing on them. And a child whose heart is failing on them generally now have other issues, like they're not able to eat well, they're not playing well. So malnutrition starts setting in.
Margaret will live on drugs for the rest of her lives.
If medication is not administered, the heart continues to deteriorate, and the part that is still functioning now compensates for the non-functioning parts, making the patient extremely weak and lose a lot of weight. And as time goes by, the patient has to undergo corrective heart surgery to replace the damaged valves, or a heart transplant. If none of the two are administered, the patient will die. Rheumatic heart disease is considered to be a poor man's disease spread by ignorance. If this is the case, then isn't it about time that the government come up with a strategy to inform parents and health workers on the disease, to prevent more infections and eventually even more deaths? Catherine Wando, KTN in Nairobi.